Opicapone is a catechol-O-methyltransferase inhibitor used as an adjunct treatment for Parkinson's disease in adults currently receiving levodopa and a dopa decarboxylase inhibitor. In this video, let's found. What is opicapone? What is opicapone used for? Contraindication. What are the side effects of taking opicapone? How does opicapone work? How to use opicapone? What is opicapone? Opicapone, sold under the brand name Ongentys, is a medication which is administered together with levodopa in people with Parkinson's disease. Opicapone is a catechol-O-methyltransferase inhibitor. In June 2016, it was authorized for use in the European Union. It was authorized for use in the United States in April 2020. What is opicapone used for? Opicapone is indicated as adjunctive therapy in adults with Parkinson's disease and end-of-dose motor fluctuations or OFF episodes whose symptoms cannot be stabilized on the combination therapy of levodopa and dopa decarboxylase inhibitor, e.g., carbidopa. Contraindication. This drug is contraindicated in people with cancers that secrete catecholamines, for example epinephrine, such as pheochromocytoma or paraganglioma, because as a COMT inhibitor it blocks catecholamine degradation. Other contraindications are a history of neuroleptic malignant syndrome, NMS, or non-traumatic rhabdomyolysis, and combination with monoamine oxidase inhibitors that are not used as antiparkinsonians, because of possible drug interactions. Pharmacodynamic. Opicapone is a COMT inhibitor that serves to improve the availability and duration of action of levodopa, L-dopa, a standard pharmacological treatment for Parkinson's disease. Opicapone works by blocking the peripheral degradation of L-dopa mediated by COMT. Opicapone has a long duration of action. Following administration of a 50 mg dose, COMT inhibition lasted for more than 24 hours. Mechanism of action. Levodopa, L-dopa, is the gold standard for managing motor and some non-motor symptoms associated with Parkinson's disease. However, only a small fraction of administered L-dopa actually crosses the blood-brain barrier to exert its therapeutic action, and patients face the risk of developing end-of-dose motor fluctuations, which reflects the rapid peripheral metabolism of L-dopa by aromatic L-amino acid decarboxylase and catechol-O-methyltransferase, COMT. Opicapone is a peripheral, selective, and reversible catechol-O-methyltransferase, COMT, inhibitor. Half-life. The mean elimination half-life of opicapone is 1 to 2 hours. Despite the short half-life, the observed half-life of opicapone-induced COMT inhibition in human red blood cells was 61.6 hours with a standard deviation of 37.6 hours. Dose. Parkinson disease. Indicated as an adjunct to levodopa/carbidopa to reduce OFF episodes in patients with Parkinson disease. 50 mg POQHS. Half-life. The mean elimination half-life of opicapone is 1 to 2 hours. Despite the short half-life, the observed half-life of opicapone-induced COMT inhibition in human red blood cells was 61.6 hours with a standard deviation of 37.6 hours. Safety advice. AUTGA pregnancy category B2, drugs, which have been taken by only a limited number of pregnant women and women of childbearing age, without an increase in the frequency of malformation or other direct or indirect harmful effects on the human fetus having been observed. That's all the information about opicapone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.